And so let's bring in our discussion point tonight, and this is in focus tonight. What we are discussing is responsible citizens can keep COVID away. And so to discuss this, we have in the studio two eminent guests. We are joined by Dr. S.M. Raheja, Senior Physician and Medical Superintendent at G.B. Pant Hospital, and Dr. Anil Gurtu is Department of Medicine at Lady Hardinge Medical College. Thank you very much, gentlemen, doctors, for being with us. So I see that you're carrying some masks with you, Dr. Raheja. What exactly are you wanting to tell us with these masks? Masks are not meant for everybody, right? Masks are only meant for people who are suffering from some sort of ailment, or or for people who are caregivers. Is that what it is, isn't it?
Definitely, because if you see, there is a severe shortage of masks in the market also, and that is why I thought I must make the people aware on it. Basically, for a healthy adult who has no comorbid conditions, they don't need to wear masks. That is very, very important. The point to understand is that mask is only meant for the people, those who have got cough, cold, fever symptoms, to prevent infection to another person.
Yes.
It is more for the person who is sick, and for that you only need this mask, which is a surgical 3-layered mask, because it is being used by the person who is suffering from cough, cold, fever like symptoms, to prevent when he coughs or sneezes, the infection does not spread to other healthy people, because it is spreading through the aerosols, and the droplets, they settle on the furniture, tabletop, curtains, fabrics, and the person who touches it, they are passed on. So only for the healthcare provider it has to be used. And there is another mask which is very popular and difficult to get in the market because of this shortage, because people are trying to stock it. This is N95 mask. It's
basically meant for pollution, right?
No, it is only meant for the healthcare providers.
Okay, fair enough.
Those who are looking after the patient suffering from corona or seasonal influenza H1N1, because N95 means it can filter out more than 95% of the 2.5 micron particles.
That's right, yes.
So it has to be only used by a specific, there is indication for using them. So I sincerely feel that if you are unnecessarily buying masks, storing and using them, you are, what will happen when the needy person needs it, actually he will not get it. So it can do more harm. So we have to ensure that we are using them rationally. Wherever they are indicated, they should be used, of course. And for a normal healthy person, they don't need to wear mask, because the mask has a life. Normally the life of a mask is 4 to 6 hours, or if and you should not use it next day or sort of thing. And if the mask is wet, soiled or dirty, it must be replaced.
That's fine.
There is a indication to wear the mask. Before you wear the mask, you should have your hand should be clean.
Yes.
And it should be really fitting tight on your face, so that no air enters from the sides. So few precautions are to be taken, and when you are removing it, remove it with clean hands and dispose it off as per the guidelines. Don't throw it here and there, because even that can cause infection.
Okay. Dr. Gurtu, let's understand why we are going in for social distancing in such a large way. This is a way to, the virus can survive on inanimate objects for about 12 hours. So, if we keep away from contaminating large amounts of areas, then the virus will die by itself, isn't it? Is that basically what social distancing is all about?
Yeah. To understand what social distancing is and how it works, let us first understand how does this virus transmit person to person. This virus is an inert particle, not even fulfilling the criteria of what we call life. It has no legs, it has no wings, it cannot move, walk, it cannot fly, and yet it has spread
across the world, yes.
the globe. Why? How? We must understand that, and then everything can be derived rationally from there, and we can make our own rules. If I have this virus in me and I am unwell,
Yes.
I am ill with corona, I cough, I sneeze. Sometimes it's more of cough with corona rather than sneeze.
Yes.
So I cough, and when I cough, what happens? A jet of air escapes my mouth as a cough, the sound, and that jet travels at a very high speed. Contained within the jet are tiny droplets, mucus, saliva, secretions. Embedded within each droplet are millions of coronaviruses, millions.
Okay.
And this jet emerges from my coughing mouth, arcs forward under the impact of the jet, and then
Yes.
gravity pulls it down and it falls on the surfaces within 1 meter or 3 feet of my positioning. Once it falls and settles on everything that's around within 3 feet or 1 meter of my coughing position, the glass, the pen, the surface, everywhere.
Yes.
If you are within that 1 meter or 3 feet, you get it directly sprayed by my cough. If you are away, and sometimes later you come there and touch that surface,
Yes, indeed.
and then with that hand you touch your nose, your mouth, or your eyes, a common habit, frequent
That's
touching,
absolutely.
the virus travels to me. So, the virus that cannot walk, that cannot fly, my hand and my behavior
Indeed.
creates a vehicle. My hands, it travels on my hands to me, and from me to you through your hands.
It's also got some help with a few airplanes also. I mean, in traveling across the world.
Yes.
That's something that.
So, we are the aeroplanes of
yeah,
this
we-
virus,
Yes, indeed.
literally.
Yeah, that
But
is
you-
why we say good hand hygiene is very, very important.
True, indeed.
And on this issue also, it is important to say that you should be washing hand as frequently as possible during the season. And there is a technique which takes 20 seconds. You have to put the soap on
Indeed,
your palm.
Indeed, doctor.
Then you reverse it, interlacing, clean your this area.
Right.
Then you clean your interlacing this area. Then you will clean your thumb, and you clean your tip of the
So the
fingers
minimum
and
amount is
nails.
20 seconds.
20.
Yeah, you should give actual timing.
Okay.
And it is always best to wash the hand
Right.
with good soap, which can
Right.
remove the dust and particles and virus as well and bacteria. And if somehow you are not able to wash hands, because if you are in a room or something, you are traveling, and I mean in the office, then it is important that you use the alcohol based sanitizers.
Indeed.
So, preferably I think washing hands is the better choice.
Okay.
Second choice becomes your sanitizers, and because sanitizer will only work when your hands are not very dirty, sort of. If they are very dirty, still the virus will escape the effect of sanitizer. And the technique remains same, because most of the viruses, bacteria, they are basically sitting
Right.
here, they are entrapped here, and they will be transmitted to our eyes, nose, mouth when we touch it.
Okay.
So,
yes,
I
but
think
we're
these
trying
two
to
things
understand
are
also,
important.
Dr. Guttu, what the government has done by imposing all these important, let's say, bans, suspending trains, keeping people indoors, stopping people from going to the malls. These are things that people need to understand. Why is this so important? Because at a time like this, the virus can basically spread into the community. We are still preventing it from coming to the community. It has not yet reached the community, and by preventing people from by the social distancing, it can't. It does not come into the community. But even if it has come into the community, the virus will die on the surfaces of the inanimate objects in this period of time. Is that basically what we are trying to do?
Yes, you said it. Basically, that this virus thrives on my closely interacting with you
That's right.
and large groups of people coming out, gathering together in high densities with high interactivity, close physical distance less than 1 meter. So, the solution, if the virus travels on my interaction with you within the proximity of 1 meter, the solution is to create a separation, and we call that social distancing. Distancing meaning a distance between any two
Right.
humans
Right.
in excess more than,
It breaks the chain.
and social containment, that is
That's right.
everyone lives in his or her home with the family and does not meet others socially. So, social distancing and social containment are the basic core objectives, and if implemented, they are known. By now we have examples of their success in other countries before
Yes.
us. They do work. Within 3 days of social distancing and closures, impact was seen in
Okay.
Wuhan and other countries. So, they work, and they work very effectively, provided we join together attitudinally to implement and make them work.
Absolutely. So
Basically-
this is the job of the people,
People,
Dr.
us.
Raheja. This is what we are discussing. The responsible citizens can actually make this, coronavirus go away by behaving responsibly, and that's what we are trying to talk about. We also know that we are living in the computer age, the network age. We know that the internet is basically a connection of computers, and we can see how viruses, computer viruses spread. In a sense, this is a system of how we, as a human being, are networked. And I mean, the virus is spreading through us. And the way to stop it is really to, create firewalls, create blockages, avoid this, a virus-infected program from meeting another program. That's the kind of system.
Exactly.
It's pretty much the same, isn't it?
That is true.
Yes.
Yeah, basically, when we talk of social containment and social distance, containment is you try to stay in your home,
That's right.
and distance is where you don't, tend to meet people around, sort of shaking hand, hugging, kissing, touching. So, this will break the chain, and earlier we do, the better the results, because the most important point is this virus is infective. Like one infected person of corona can infect 2 to 3 persons. So, you can believe one person coming in contact with 3 people, 2 to 3
Right.
persons are, then those 3 come with another 3. So, it goes 9 into 9, 81, 81 into 81, like it will go exponentially.
Yes.
So, earlier we do,
That's right.
the better it is, because then we can really cut down that transmission of disease, and it is just breaking the chain at the right moment. And earlier we do it as a social responsibility, as a national responsibility, stay at home, as our honorable Prime Minister has said.
Right.
And really, it's a teamwork. You have to, government and the people of India have to work together. They have to rise together to the national issue.
Absolutely.
And we can do it if we do it sincerely and confidently.
Dr. Gurtu, let's also understand, the other side. The one is to contain it. The other, there is research that is going on and on right now to try and find a cure or something that can help the treatment of a person so that it doesn't reach a stage which is critical. The virus in most cases have been mild. Most of a very high percentage of the people recover. But there are reports that go around saying that sometimes it causes severe problems to the pulmonary tract, and you can't breathe, and you lose your life as a result of that. So to prevent that, people have to be intubated and things like that. But it's basically it survives only for 14 days. The virus, is that the case?
The incubation period.
In the entire process, a person gets infected. 14 days after that, he should be okay. It can't continue and for a long.
He can express the symptoms
Yeah.
up to 14 days.
Right.
Average. The median is 5 days, but up to 14 days. For complete cure, he or she might require anywhere between 2 to 3 weeks
2 to 3 weeks.
of admission. But the good news is that more than 80% of those infected, those who get ill with this virus, recover without any problem, just like any passing influenza.
like any
So, but
cold,
the
yes,
problem,
influenza.
they are very mild cases. 80% will be mild when we take the whole population. That's quite a large chunk
Right.
will be without any problem. But the problem that generates is that since they
The
are
percentage of deaths in China was not very high compared to the over 80,000. They had about 3,000 plus deaths. In fact, it went up to over 80 plus thousand infections. But in the death rate in Italy is much higher, of about 10%. Is that some sort of some cause of concern that, you know, I mean, the second stage has moved from China to Italy. It's causing it's a much more stronger infection there.
virus hasn't really mutated into a more virulent mutant, that is
Okay.
for sure as of now. What accounts for higher mortality in Italy compared to China is yet not clearly
Not really.
known.
Okay.
The only two factors that we know as of now which can affect the outcomes, that is tilt the outcomes towards more adverse ones, are one, an underlying disease, chronic long standing disease involving heart,
Yes.
lung,
Okay. So you have to
blood
have
pressure
some
problems, and age.
Fine, fair
60,
enough.
as you move above 60, the mortality rates, death rates show a steep rise.
Okay.
Below that, it's so low that it's almost 0.4, 0.3% as you go below 60.
Okay,
And above that, it
we're
shows.
running short of time. A final word from you, Dr. Raheja. What would you like to tell people? They have to be prepared for, you know, in a sense, social distancing, to keep
Social-
themselves occupied within themselves and understand the importance of their own behavior for society.
That is true. Social containment, social distance, these are the key point right now. And those who are at high risk, like elderly people, those who are diabetic, cardiac patient of renal transplant, patient taking steroids, pregnant women, small children,
Yes.
patient of COPD or respiratory
Right,
diseases,
right.
they need to take extra precaution. That it has been seen these people are likely to get infection faster because of the low immunity, and if they get infected, the outcome is also not good. So important is
Yes.
we work together, work as a team,
Absolutely.
and rise to the nation's call and do
That's-
it together.
So on that note, we leave it there. Thank you very much, Dr. Raheja and Dr. Anil Gurtu, for joining us here on Newsnight and helping us understand the importance of social distancing and containing this virus at this particular stage, because we should not allow it to become a community spread, because at that, once it does that, then it's going to be pretty difficult to contain it. So that is why we are taking these measures, and everyone